Thanks for staying with us. So we're going to be starting with the Honorable Commissioner for Health in Kogi State, Dr. Saka Haruna. Welcome to the show, sir. Are you there?
Thank you.
Good to have you.
Thank you for having me.
So according to NCDC, Kogi State has the lowest number of cases recorded in Nigeria with only 5. In fact, the governor of the state does not believe COVID-19 exists despite being surrounded by 9 states and the FCT, the state being the transit hub of Nigeria. So we have with us the Honorable Commissioner to tell us exactly what the magic they're doing in Kogi State. How come your cases in your state are quite low? Is it that you're not testing enough?
Thank you very much for having me this morning.
Yeah.
First, I want to correct the impression that the governor does not believe in existence of COVID-19. That is not true.
Okay.
And I don't think a firm as giant as your outfit should peddle such lies. It is not true. He has never for once implied non-existence of the disease. What he did was to ensure that we do not just look at the medical solution. In fact, he has been very scientific in his utterances about COVID-19. There are several stages of disease prevention, several levels, at primordial level, at primary, secondary, tertiary, and quaternary level. What the governor was saying is ensuring that the cure for the disease as being implemented by PTF, NCDC, Federal Ministry of Health, does not result to harm for the people. A situation where the cure is worse than the disease itself. That is what he was calling for. That is quaternary level of disease prevention. Your intervention should not cause harm. That's what we call disease smuggling, commercialization of disease. That is exactly what is happening in the nation, and he's not happy with that. It has crippled our economy. And before 2020, Nigeria used to be classified as second largest contributor to under 5 mortality worldwide. Second largest. That is a statistics. I'm happy. I'm sad.
Sir, when you say commercialization of the disease,
interview.
What exactly do you mean? Are you saying that people are using this to collect money? Is that what? Could you please clarify what you mean by that?
This is not a new term. This is quaternary level of disease prevention. You ensure that your interventions do not cause harm to the people. Don't romance disease. Ensuring that the source of cure does not constitute harm to the people. That's exactly what the governor has called for. Government at all levels must ensure that this call is instituted in the country. And that is where those charged with the responsibility with the national response to COVID-19 are getting it wrong. Now we have damaged our economy. If you look at the ECHO data, you will see that Africa is currently leading the charts in terms of growth rates worldwide. So many countries, not less than 10 countries, have been classified among the countries that emerged strongly from 2020. That is an advantage to Africa, that Africa has been relatively spared against COVID-19. Should be taken as an advantage. But what we are doing in Nigeria, that advantage had already been converted to a disadvantage against us. Like I mentioned, we are already in a recess economy. Secondly, Nigeria used to be second largest contributor to world under 5 mortality. But currently, in 2020, we overtook India. We are now the world capital of under 5 mortality.
All right, let me get a few more questions in for you, sir. Go ahead.
Using our population in 2019, Nigeria was projected from 2006 census to be 201 million. Do you know what we recorded? as death mortality rate among under 5. A whopping 858,000 Nigerian children died because of this neglect for other aspects of our health sector, concentrating attention to only COVID-19 alone.
Okay.
India, with 1.3 billion population, recorded 824, which is now second highest number of deaths among the under 5.
All right, point taken,
worldwide.
sir. Let me get a few more questions for you, sir.
So, sir, just a quick reminder of how controversial the governor of Kogi State had been on COVID. He recently talked about the vaccines as a means to spread the disease against the people, querying again the method of vaccines that were coming into the country without evidence. This was reported by Premium Times. Premium Times also reported the governor saying that it was massive testing in Kogi State that the NCDC disputed to be a false claim. He said that NCDC were allowed into Kogi State to test people everywhere, schools, markets, and all of that, and that there was no single positive case in Kogi State. The NCDC disputed that. So TVC as a station are not the ones peddling any unconfirmed rumors. These rumors have not been reported by you or the governor on, print media.
In addition,
anywhere.
the Punch newspaper also published that Governor Yahaya Bello of Kogi State alleges that COVID-19 is an artificial creation aimed at causing fear and panic among people. So these are.
And you also just mentioned about it being a commercial,
and and also he had a big awards show recently that was covered on. I watched it live
on national TV,
and most of the people there were not wearing masks.
Honorable Commissioner.
When you want me to talk, please do let me know.
Okay. All right. So let's go to. So today in Kogi State, are you testing? Or what are your numbers looking like? And how have you been able to overcome the increase in infections in your state? Let's start with that.
Well, I want to dispute those allegations. Okay. The governor has been very scientific in his utterances about COVID-19 control. What he does not like is the way and manner by which COVID-19 is being managed in the country. So most of what you have raised are lies peddled against Kogi State. Kogi State has been very proactive in our response to COVID-19. Even before the February 27th, when the first case was discovered in Nigeria, we leveraged on the existing COVID Lassa fever platform that we have in Kogi State to sensitize and create awareness among our people. And by 23rd of March 2020, we inaugurated our squadron against COVID-19 in Kogi State. During the same time, we allowed the civil servants from level 1 to 13 to work from home. These are measures taken only by Kogi. I think the earliest state was Lagos, which created this awareness around 22nd, and that of Kogi was second to Lagos on 23rd. So how come, if we have disputed the existence of COVID-19, how come we have spent so much to control the disease within the state? We're the first to procure and distribute free face masks to our people. We also procure and distributed hand-washing devices and material to the people free of charge, especially in the parts and areas where we feel the disease can easily invade the state, and those at risk of coming down with very advanced form of the infection.
That's good to know, sir. Let me go on a quick break. When I come back, we'll continue this conversation with you, sir. Let me go on a quick break. We'll be right back. Thanks for staying with us. So we still have with us the Honorable Commissioner of Health, Kogi State, Dr. Saka. Mariam had a question for you before the break.
Yes, my question is, sometimes, things are not so clear to those from the outside, and I was just wondering that given the very almost not very low number of reported cases in Kogi State. Could you tell us exactly what you're doing? Almost also like an advice to other states, what they can learn from what Kogi State has done, particularly to drop this. And also let us know if it's also a problem or maybe there's a challenge concerning how they can have access to testing, if that is the case. So let's know, is this something specifically or specially that you're doing in your state that other states can learn from, or even the world can learn from? And two, if it's actually a challenge that you're struggling with and may need help with.
Thank you. I want to state categorically clear that we have a molecular lab in Kogi State, which was calibrated on 10 June 2020 and was validated and certified by NCDC. NCDC did join us in the same lab, and series of tests were carried out in the same lab. So coming out to the public to deny this is a great concern for me and should be a great concern for the nation. The NCDC team that visited Kogi and spent 4 weeks in Kogi State visited our isolation centers, and they expressed satisfaction. In fact, we were commended to have organized a permanent isolation center like we have in Kogi State right now. But coming to the public to dispute that is a thing of great concern for me, because PTF is a committee set up by Mr. President, and as such, we expect high level of performance from this committee. They do not have the right to label our state a high-risk state without data, just based on political allegation. This is not true. If you look at NCDC charts, you will see that they recorded 2,611 tests as at January 2021. And yet they come to the public to inform the public that Kogi State has not carried out tests. That is the one they accepted from us. So when we discovered that they were not updating our data on the National Data Bank, we stopped that futile exercise of sending test results to them weekly, because all they wanted to see is positive cases, which is not in existence. We cannot we cannot manufacture cases. Even the 5 they assigned to Kogi State were FCT cases, not Kogi State cases. So to me, we have done so well and we deserve commendation. We were one of the earliest states that constituted a committee saddled with the responsibility of COVID-19 control in Kogi State that we call COVID-19 Squadron. Right. We were the first state in Nigeria to procure and distribute free of charge face masks to population at risk and hand-washing devices. We converted the whole hospital to infectious disease center only to manage and attend to people who may have complaint respiratory symptoms, so that in order to douse the tension. You can see that
unfortunately, we have to wrap up. I mean, we're running out of time, but I have to run because I have another guest in the studio. But I have to run, unfortunately. I have a guest from the Acting Commissioner for Health, Dr. Jibayo Adeyeye, also on the phone to give us an update from Ondo State. Thank you very much, Dr. Haruna from Kogi State. We appreciate you. We're going to bring you back because we are quite concerned about Kogi, but we also understand that you have your place and you've been able to explain to us exactly what transpired and why your figures seem to be very, very low in Kogi State. But we'll come to you another time. Unfortunately, I have to wrap up on you.